Small hospital on the islands of Zanzibar that's called Symposium. And literally translated, that means one coconut tree. And the story goes that there was a terrible cyclone that swept over the islands of Zanzibar and wiped out all the trees but one, a single coconut tree, and that's where they built the hospital. But what's really interesting about Symposium is not the story of how people survived a terrible storm. What I think is especially interesting is how people are surviving the storm of global health challenges each and every day on the islands of Zanzibar, as typified by that hospital. On the day that I was there, and this is again just a month ago, our guide was Dr. Mohammed Jadawi, who is an old friend of mine from my days as ambassador. He's the principal secretary of the Ministry of Health and a licensed surgeon himself. And he took us upstairs at Symposium to the pediatrics ward. And as we were walking in, I saw that there were about 15 beds there. Dr. Jadawi said to us that just 3-4 years ago, there would be 3 children for every single bed in that pediatrics ward. But on the day that we walked in, there were 3 children in the entire ward. The first child was a child that had what Dr. Jadawi called clinical malaria, in other words, symptomatic but not confirmed by a test. The second child was a truly pathetic sight. The young child was largely listless, sickly thin arms, cheeks were drawn, eyes were open, but unseeing. And Muhammad told us that the child's eyes had been damaged by vitamin A deficiency. And the third child that we saw was an even more heart-rending sight. Her skin was so badly disfigured that as we were walking up to her, she looked like a burn victim. And that's what I began to say, and Dr. Jadawi said, no, that's severe malnutrition, protein deficiency. But he looked at her and looked at me and said, we can help her. Now I tell you that story because for me it drives home several important lessons about health disparities and the global health challenges and opportunities that are out there these days. The first lesson, and it's one that's important for us to remember, is that historic progress is being made right now on a number of global health fronts. As Mohammed Jadawi said that day, not so long ago, there would have been 3 children to a bed, 45 in that ward, not 3. The good news is that because of a focused scale-up on proven interventions and, quite frankly, some of the medicines that we just heard talked about, we have an opportunity in front of us to conquer some of the diseases that were once believed to be inevitable. You know, if you've spent any time in Africa, you'll meet person after person who will say, I am the oldest, I was the 3rd born, or I was the 4th born, because his brothers and sisters had died before him in childbirth. But in malaria in particular, we're making extraordinary progress. On those islands of Zanzibar, just a few years ago, it was 40% infection rate of malaria. Right now it's below 0.5%. They actually believe that by 2015 they will eliminate entirely malaria from the islands of Zanzibar. In the area of neglected tropical diseases, lymphatic filariasis, or elephantiasis as it's known, there are now elimination programs for this terrible disease in 44 of the 83 endemic countries. River blindness, it's already been eliminated from 10 West African countries, and there are plans to do so in many other countries on the continent. So we should feel first good about the progress that's been made and the opportunities that lie ahead. Secondly, the progress that we're making on diseases like malaria and river blindness and some of the neglected tropical diseases, they free up for us resources to take on some other global health challenges. There's the obvious. In my Zanzibar story, the drop from 45 patients to 3 patients means that there are more than 40 children free of the disease, not in those beds, free to help their parents, or play ball in the streets, or hopefully learning in school. But more realistically, what it means is that there are more beds available, hopefully more healthcare workers available to take on the many other healthcare challenges that are out there. Like that boy with the damaged eyes, or that girl with a severe protein deficiency. The third lesson is one that has really struck me in recent weeks as we've been talking about at Malaria No More, about how we describe the challenges that are out there in malaria. And I think we have to be careful when we talk about global health and global health challenges, not to look at those challenges through American eyes, which we often do when we talk about numbers. In most places in America, a child is generally either sick or they're healthy. Of course, that's not the way it is in so much of the world, in the impoverished nations of the world. Children are never quite healthy in those countries. Maybe they manifest or they don't, but they're hardly entirely healthy. If a child is struck by malaria, for example, in his earliest days of life and survives, he will very likely suffer lifelong disabilities, cognitive disabilities, profound disabilities. Or he may just be weakened and vulnerable to other diseases and illnesses. And of course, he or she is already likely to suffer from poor nutrition, bad water, etc. So the child may not be down with malaria in the sense of being in a hospital bed, but neither is he strong and ready to learn. My first night as a volunteer teacher in East Africa, in Kenya, some 20 years ago, my headmaster took me to a funeral. I went to the funeral of one-year-old twin boys who had died of measles. And when I said to him, "Thomas, you don't die of measles," he said, "Well, here you do." He said they didn't really die of measles. Measles pushed them over the edge. But they had malaria, and they had poor nutrition, and they had probably other diseases and parasites and health challenges that are out there. So when we talk about global health and how we combat the global health challenges that are out there, I think it is important that we realize that it isn't so black and white as we tend to talk about it here. I think that's one of the reasons why you're seeing the President's administration, President Obama's administration, unveil its recent Global Health Initiative. The Global Health Initiative is designed to build upon the marvelous programs that are already there, PEPFAR, the President's Malaria Initiative, and some other programs, and try to look for ways to integrate the services that are provided in some of those programs so that we get stronger health systems to begin with, and we have greater access to health care in some of those countries. At Malaria No More, we think that's a good idea, and we think that there are definitely some areas, particularly in the areas of diagnostics and lab facilities, where we can look for integration to strengthen the systems, recognizing that, again, when we talk about the health, particularly of infants and women, pregnant women in particular, who are most vulnerable in places like Africa, we can't just look at it in black and white terms and through American eyes. It seems to me that we're living during pretty exciting times on the global health front. Again, we're now working on challenges and taking on global health challenges that seemed inevitable. I couldn't help but note as I was getting ready to come here today the story that broke yesterday that in fact King Tut died of malaria. And of course when they examined and did the DNA testing and took a look at the mummy, when they said he died of malaria, well, it's true, but of course there were a number of afflictions. Malaria was one of those afflictions. And so, again, when you take a look at those challenges, you realize, A, they've been with us a long, long time, and B, when we truly take them on, we can't just think in black and white terms, but have to realize that we need to work to strengthen the system as much as take on individual